What does it mean to be called crazy in a crazy world? Listen to Madness Radio, voices and visions from outside mental health. Welcome to Madness Radio. This is your host, Will Hall. And today I'm joined by co-host and show producer, Jessica Gallinger. Welcome, Jessica.
Thank you. I'm very excited to be here.
It's great to have you. And before we introduce our guest, I want to just welcome you to your first time co-hosting on Madness Radio. And thanks for your work producing. And you actually found our guest and you found the book. And I'm very excited to have him on the show today. So maybe we could just introduce you to the listeners. Just say a little bit about how you came to be co-host and producer for the show and what your connection to all this is.
I'd be happy to. I had my first involuntary hospitalization about a handful of years ago. And at the time, I believed everything that I was told by my psychiatrist and the mental health system. The experience for me felt euphoric. It felt deeply spiritual and meaningful and transformative. But when I came out of the altered state, I didn't really know how to make sense of everything that had happened. And psychiatry came in and told me that none of it meant anything and I couldn't trust my thoughts and feelings and that I had to surrender basically my body and my mind to the psychiatric system, which is how I think of what happened now.
Yeah, welcome to the club, Jessica. It happened to a lot of us.
Thank you. Yeah, so Madness Radio was, I think, the first resource I found of folks who were like me. And I got to hear voices of people who'd had similar experiences and felt the same discomfort with how they were treated. So it opened a door to a community of people who could give me some explanations that I had been lacking and dispelled some of the confusion and loneliness that I had felt. So I'm very grateful for your work in Madness Radio, Will, and I'm really glad to be participating today.
Welcome, Jessica. And how are you doing now? I mean, where are you at with madness and altered states and psychiatry and all that these days?
Thank you. I'm well. I'm doing really well. I withdrew from drugs against medical advice 4 years ago, and it was a rough transition. I would say it was about a year for me to kind of feel like I came back to feeling normal.
What drugs were you taking?
The one that really messed me up was risperidone, but I've been on a number. Lithium was the one I was on most consistently. And so, yeah, I'm doing well now. I would say I'm someone who, if there is something really distressing, I am someone who could be at risk for psychosis if I don't get enough sleep. So I still see myself as having that in my life, I suppose, but day to day, I have no impairments. I am well. I am completing a second undergraduate degree in science at the moment and interested in studying adverse effects of psychiatric drugs and alternative biological, physiological notions of what's happening in psychosis and hoping to do graduate school in that area.
So you're studying science?
I'm studying science. My original goal when I started it almost a decade ago now was to apply to medical school. And then I had my first psychosis and was hospitalized. And following that, I realized that I would never be able to be licensed to be a doctor. I might be able to get into medical school and complete a medical degree, but no one would license me. And in fact, I can't even get licensed to drive a car right now.
You're in Canada, yeah?
I'm in Canada. I'm in British Columbia. Yeah. If I had a family doctor, I might be able to do that, but no one's willing to support my driver medical because I am unmedicated and I have a terrible diagnosis. And so no one wants to get behind that.
Yeah, this is psychiatric Jim Crow. That's basically what that is. That's systematic denial of your rights. And you discovered our guest in his book, Justin Garson. Do you want to introduce Justin and welcome him on the show?
Yeah, I would love to. Justin is a professor of philosophy at Hunter College. He studies changing paradigms of madness. He's the author of the academic book, Madness, A Philosophical Exploration by Oxford University Press. As well, he occasionally writes for Eon, Psychology Today, and Mad in America. We're really glad to have you with us, Justin.
Thank you so much. I'm really happy to be here.
Yeah, Justin, I'm really excited about your book. Congratulations, Madness, a Philosophical Exploration. And what caught my attention right away is that you're making a distinction between the kind of dominant view, which is madness is a failure of the system, it's a breakdown, it's some kind of dysfunction, and another approach, which is actually a very deep philosophical trend or thread, we could say, that you explore very deeply in your book, which is the idea that madness is a way of dealing. It's a creative response. It's a way of coping with things. It's actually some way that the individual develops a strategy for dealing with what they're experiencing. And this is exactly what R.D. Laing saw madness as. I think it's a view that is extremely useful, and it's certainly something that I have found useful in my own life. And I thought it was interesting also how you're not just simply making it an either or between these two things. Like, for example, Jessica mentioned sleep. The reality is that anyone that doesn't get sleep is going to be psychotic, if you want to call it that. I mean, some of us sooner than later. And Jessica, you and I are part of the sooner club, maybe, but anyone is going to go psychotic. So it's not about tossing all of the biological breakdown views out the window, but rediscovering this whole other story, which is that actually maybe these are strategies that the organism or the individual is using. So I found your book really interesting, and I'm really happy to have you on the show and be talking with you and Jessica about it.
Thank you.
Yeah. So how did you first get interested in this? How did you start to step outside of the dominant view and recognize that there was this other view, madness as strategy, that you wanted to explore?
Well, I think I've always been interested in our ideas about psychiatry and ideas about madness. I have a lot of madness in my family. A few months after I was born, so in the early 70s, my dad was actually diagnosed with paranoid schizophrenia. And what's funny, not funny, haha, it's funny, ironic, is that he was working under the President Richard Nixon at the time. And he started forming these delusional beliefs that he was being surveilled and spied upon by Nixon, which is, Nixon. I mean, later people started to figure out that Nixon loved bugging his staff whenever they would get out of line. But his beliefs started really spiraling into something much more extreme. He thought, his doctor put a tracking device in his anus. He thought my mom was a government spy. He thought the Washington Post was writing stories about him. But at the time, he was very well read. He knew about R.D. Laing. He had read Rollo May and some of the transpersonal psychologists. And so he was willing to see a psychiatrist, but only under the condition that he wasn't going to be drugged. And he found a psychiatrist who was able to help him and work with him in some ways. And he was able to continue working for the government for about 10 years or so. 1980s, 1986, everything changes. He started having voices again. He had, again, the delusional belief that God was talking to him and telling him to use his position in the government to promote nuclear disarmament. And so he was trying to promote nuclear disarmament. And he thought that the French actress Catherine Deneuve was talking to him and giving him guidance and support. But at that point, psychiatry changed immensely. So he would be hospitalized. He was diagnosed this time with bipolar disorder. He was given a combination of drugs. In his case, it was a combination of lithium and Mellaril. In that particular combination is actually known to be neurotoxic now. So that pretty much took care of the voices, or at least dampened them enough so he was able to function, at least according to our society's conception of what good functioning is. The drugs eventually caused pretty serious motor problems. And then I'll just say this, in the late 80s, I was diagnosed with depression. I was hospitalized for about 6 weeks. This was the height of the Prozac revolution. And so all of the messaging that I got was there was a chemical imbalance in my brain. It could be reversed by using this particular drug. And so I'm very much a child, a product of these dysfunction-centered messages.
It's so interesting. So your dad had two experiences in two different eras, the 70s when it was more maybe available to have a psychotherapy and less medication and less pharma oriented approach. And then he has another experience in the 80s, and things have just really shifted. I mean, pharma's basically dominated, the neuroscience has come in, and now he's just really heavily medicated.
Mhm.
So then at what point did you get interested in stepping out of the chemical imbalance Prozac revolution, thinking about your own depression?
Well, a lot of it probably started in graduate school. So I decided I wanted to be a philosophy professor, and I was interested in mental illness and, this whole question of who decides what's normal, who decides what's abnormal. I mean, it was always clear to me growing up with my dad that he probably could have avoided a lot of the hospitalizations if people just chilled out a little bit and had somewhat more expansive ideas about what was normal. I mean, he was harmless, but he scared people in his apartment complex with his ideas about God and Catherine Deneuve. And I just thought, how much agony could he potentially have avoided if people just had slightly more expansive ideas about what's normal, what's acceptable, what's tolerable? But in graduate school, I came across this little book, and it was called Why We Get Sick. And it was written in 1994. One of the authors is a psychiatrist, Randolph Nesse, and the other author was an evolutionary biologist, George Williams. And the idea behind the book is that we'll never really understand health and disease unless we look at it in the big picture of the evolution of life on Earth. And when we do that, what we'll find is that some of the things that we think of as diseases are actually your body's designed mechanisms for dealing with problems. So they talk about fever is an obvious example. People used to think that fever was a disease. They used to just combat it with drugs and bleeding and vomiting. We've got to destroy this fever that's taking the patient's life. And then a few hundred years ago, somebody said, well, wait a minute. Maybe fever is actually part of your body's designed mechanism for dealing with infection. And of course, that's the theory that we understand today. So the authors in this book, they have this one little chapter called Are Mental Disorders Diseases? And they talk about depression and a few other things. And they say, no, not all mental disorders are diseases. Some of them are kind of like fever. They're like designed responses to the problems of life. And they started talking about depression specifically. And they said that depression, far from being a chemical imbalance, in some cases, actually just your brain's wake-up call. It's like your brain trying to tell you that something in your life is not going well and needs more attention. In that respect, it's just as functional, just as designed as fever or even physical pain you experience when you put your hand on a hot fire. And when I read that, I just thought, does anybody understand how subversive this book is? I mean, here are some scientists who are, it's like they're throwing a hand grenade in the psychiatric establishment. And if anybody really read and understood what they're saying, this would call for profound transformations in how we think about madness and how we treat madness to the extent that treatment makes sense. And so that really prompted me on this journey of looking historically at changing paradigms of madness and changing ideas about psychiatry.
Yeah, I sometimes think about depression. I mean, everybody's different. People have different experiences, but it's almost like one part of the person is going on strike against another part of the person. Like people,
Mhm.
they say, okay, I have depression, I have low mood, I can't get out of bed. Well, let's treat that. Let's help you get your mood up. Let's help you get out of bed. But wait a second, if you talk to the person, they're in a terrible relationship where they're being emotionally abused. And the depression might be, oh, like you said, like a wake-up call. A part of them is refusing to go along, where another part of them, maybe the more conscious part, really wants to hold on and wants to keep going. Or someone who's in a lousy job or some kind of life circumstance that they need to be wakened up to by the depression. So the depression has a purpose. And I love that idea of bringing in the evolutionary biology perspective, because that's something that's been noted, is that if psychosis is purely breakdown, then why does it persist for the species? Why wouldn't it be selectively drop away in the evolutionary process? Because it doesn't provide any kind of advantage, it provides a disadvantage. But then if we think about it as actually functional, as like a wake-up call, or the possibility of the organism going beyond its circumstances by going into visionary or super creative or breaking the rules of social convention, then we can see how psychotic experience, if we want to call it that, could be very useful to the species and can actually confer some advantage. And then if you think about it in terms of like an initiation into a healer or a prophet or some kind of
Mhm.
spiritual leader role, then absolutely that's functional to the species. So
Yeah, I absolutely love the way you put that. And I love this idea that depression or some of the things that we call psychosis can really be the organism's protest against a form of life that's just no longer functional, the sane response to an insane world. And if you think of it like a disease or a malfunction or a disorder, you're not thinking, okay, have the conditions of life that create so much depression and anxiety and so-called personality disorders and what we call psychosis, have the conditions of life just become intolerable in a way that the most natural thing is to rebel against them. And let me just say real quickly about the evolutionary psychiatry. I mean, a lot of people don't like applying evolutionary perspectives to think about human behavior because they think about eugenics and they think
eugenics,
about
yeah, yeah.
all kinds of terrible abuses of these kinds of evolutionary perspectives. And I'm not sold on the evolutionary perspectives at all, but what I do think is remarkable about them and what I think is remarkable about this book is precisely what you said, that people who come from an evolutionary background are generally thinking about function, purpose, design. If something persists in the human species across a lot of different cultures, and it's a significant proportion of the population, say with depression or anxiety, or there's always been these experiences that we now describe as psychosis. If something persists for a long time across a large subset of the human population, the first question somebody from an evolutionary perspective comes up with is, well, what is this for? What's it doing? It's just like if you look at the kidney or the appendix or some weird appendage on some old insect, you think, well, I wonder what this was for. So I think that that's what I most value of the evolutionary perspective: purpose, function, design.
And I think what's important about your book as well is that you're not discounting that there may be times when there's breakdown or dysfunction. Like I know that for me and for a lot of us, looking at environmental toxins or looking
Mhm.
at exposure or medication side effect, for example, you mentioned Prozac. Well, we know that one of the side effects of Prozac is, hello, mania. So it may be that we want to be open to the usefulness of an altered state like mania as a strategy. But then on the other hand, we might want to sometimes just simply say, oh, stop taking the Prozac. That's going to solve your manic state. So I like that you have an awareness of that nuance. You're not trying to proselytize or replace one perspective with the other. You're trying to actually more balance our consideration of what's going on.
Yeah, I mean, on one hand, absolutely. The moment you start thinking that, okay, maybe something like depression, or many of the cases that we think of as depression are actually functional, purposeful, they're the organism's revolt against untenable life circumstances, then immediately you have to also start thinking about dysfunction. Okay, how can these very delicate programs be dysregulated or spiral out of control? So I think that if you think of depression or some of the things we call psychosis as somehow functional, you could also imagine that there are conditions under which they're not going to work right, or conditions when environmental circumstances might throw them off. That said, though, I do have the feeling that a lot of times when I talk with psychiatrists, there's a sense of, okay, Justin, you're right. This is so interesting, function and dysfunction. And I agree that we should be pluralistic in our perspectives. But then sometimes there's an almost immediate knee-jerk response to go toward dysfunction. Like, okay, I can see how maybe some of the things that you're describing it about depression, maybe it's the organism's revolt against untenable life circumstances. But really, I mean, when you get to psychosis, that's really dysfunction, right? Let's see how far we can explore these alternative function, purpose-based framings.
Yeah, I think one of the things that I'm often doing as a counselor working with people is just trying to understand the situation. Like, what is the situation that the person is in? And it usually involves their relationships. and their life choices and the situation, the circumstances, the oppressions that they're involved with that are affecting them.
I was thinking with the word function, we might be setting ourselves up for some trouble just with that word. It kind of implies productivity, I would say. So from an evolutionary biology perspective, maybe selection is a more neutral word that doesn't carry some of the baggage that we have with function. I wanted to ask Justin, in your book, you talk about the dual mind and how I believe there was, I forget what thinker suggested, we have two hemispheres, therefore we have two minds. And the structure of the dual mind allows self-reflection and self-awareness, and madness is implicit in that structure. Could you talk about that a little bit?
Yeah, absolutely. And I agree entirely. The word function is very loaded because it has these kind of dual meaning. On the one hand, it could point to something like design. Well, what if depression is really a designed response? It's functional in this kind of deep way that it evolved for a reason. But yes, then function also has this kind of ugly sense of productivity. Depression and anxiety are bad because they make you a less productive worker, and so we need to get you up and functioning again. So that's a good point, and I am aware of this kind of ugly other meaning of the notion of function, where everything is about getting people up to speed and back to work.
Then that raises the question of, is society itself functioning, or maybe it's society that's breaking down, that's dysfunctional. And so disconnecting with society or going against the grain of society might actually be functional from a different perspective. But I think you're absolutely right that we should not conflate the idea here of function and strategy with productivity and all the neoliberal values. I think this is something that Lang mentioned, that you can be in formation with the
Yes.
herd or the flock, but if you're in formation and you're in line, if the flock is going the wrong direction, then no. If you're out of formation but you're going in the right direction, you're the one who's more on track. So that, I think, is really important point that you raised, Jessica, that we not conflate those two things.
Yeah, I love that metaphor in Lang about the formation of jets, and they're all moving in the one wrong direction, and then one of them starts moving in the right direction. But of course, it's going to be seen as a disorder or dysfunction somehow. But yeah, you mentioned Arthur Wiggins. So, I mean, one of the things that I do in the book is I just look at these traditional thinkers from the history of madness, really going back to the Greeks, and then, some of the medieval thinkers and some of the early Enlightenment thinkers like Robert Burton. And then I found this whole treasure trove of thinkers in the 1800s who I think were really exploring this idea that what we think of as madness could be purposeful in some ways. So you have a German psychiatrist, a German physician, Johann Christian August Heinroth, who has this 800-page treatise on madness. And in a lot of ways, it reads like a traditional medical treatise. There are various ways that the mind can fail to work the way it's supposed to. But then at one point, about halfway through, he starts describing this one condition. And he says it's like the patient is entering into a kind of dream world of images and ideas. But then he's very clear. He says, but nature itself is bringing about this kind of pause in the patient's normal relationship to their environment, because they're dealing with something that's just too incredibly painful to confront. So nature, in its infinite wisdom, has kind of allowed the patient to enter into this dream world. And the best thing in those cases is just to allow it to run its course and allow nature to have its healing.
What year is he writing that?
This was 1818, which he has this remarkable textbook of mental disturbances, or textbook of the disturbances of mental life. But a lot of I spent years just digging through these old texts, and occasionally would find this utter gem like that. And I would think, where has this been in the history of psychiatry, the whole history of madness? Why don't we know about these gems where people start speculating about the hidden purpose or function of madness? And even Felipe Pinel, who's thought of really as one of the heroes of the history of psychiatry and helped to introduce this much more humanistic perspective to the asylums of Paris, breaking off the chains of the mad patients. People remember that, but when you actually read his work, he was very, very fascinated with this idea that some of the things that we think of as psychosis might be kind of like fever. They might have some kind of a healing or cathartic power. And in the best of cases, maybe you want to let them run their course. Maybe you don't want to drug and restrain the patient and throw them into a dark room and force them to take their medications. Really breakthrough advice at the time.
And if that's true, if that psychosis or madness, these altered states do play some kind of positive role, then that's, we should remember, embedded in cultural traditions. It's embedded in the way in which institutions surrounding individuals are set up to take care of that and to respond to it. Because, you know, we think of individuals as individuals, but historically, people are not as individualized as they are in contemporary consumerist capitalism. So I think part of the puzzle here is that we've lost that kind of institutional tradition response. There are no elders, there are no cultural traditions, there are no rituals that people can respond to those breakdowns, that weird behavior, that kind of psychotic expansion. And then to fill the gap, here comes capitalism saying, oh, this is a market for our drugs, this is more patients for insurance billing for our hospitals. And then it just kind of compounds the disconnect and the dysfunction that happens.
I like that point, Will, and it reminds me of the introduction of your book, Justin, where you're talking about Hippocrates and the magicians and how Western medicine exists by defining itself against so-called magical traditions. So I wonder how much of the predicament we're in now is because all of the cultural traditions that honored mystical or other ways of knowing have been excluded from legitimate healing. Those traditions have been extinguished violently in many cases. Could you talk about that?
Yeah, that's a great point.
I'm remembering the book by Ethan Waters, where he pointed out to me that there's research showing that a lot of traditional responses to madness or voice hearing or altered states that is seen within a religious context. Oh, this is spirit possession. It's a magic kind of pre-enlightenment understanding, but actually the outcomes are better. Like, why is it that treating someone as they're possessed by demons or jinn, why is it that people actually go through it and then come back to the society? Well, it has some of these basic ingredients, like you provide framework of meaning, you keep the person included in society, you have an expectation that they're going to get better. I mean, sure, it's not in a technological, we could say scientific way, but it's actually works better in terms of actually taking care of the person. And I like what you said, Jessica, as well, because the definition against these magical traditional ways was also very much a political struggle, and it takes place in colonial context. It also took place in the US. I don't know exactly the history, but at some point, the pharmaceutical industry, and like you were saying, Justin, with your father, the social psychiatry, the interest in Freud and psychotherapy, and not to say that there weren't problems in that, but that was there and it was in place up until the 60s and 70s. And then it's really in the 80s with the deregulation that comes in with Reaganism, the pharmaceutical industry just really starts expanding into healthcare in general. And so there's this political economic struggle that has pushed down and suppressed this other way of looking at madness.
Yeah, I mean, I'm glad that you brought up the Hippocratics and the early Greek tradition because, yeah, they absolutely, this dysfunction-centered point of view goes back. You know, early times, it's always been part of our collective language. You know, the Hippocratic doctor who wrote On the Sacred Disease, probably 400 BC, says all the different forms of madness are just blockages of airflow to the brain. You have the four humors, the blood and the yellow bile, I think, and the black bile, and they can get out of hand or imbalanced relative to one another. And then they block the flow of air to the brain, and then the person goes mad. And of course, today we see the Hippocratic doctors as these heroic figures. They were finally bringing, or at least trying in their own way, to bring medicine into this more naturalistic, scientific, medical. Yes, they were wrong about the four humors, and some of their specific explanations, of course, were wrong, but they're thought of as very heroic. And particularly, they're thought of as heroic in relation to this more kind of spiritual, magical tradition. One of the basic ideas being that the things that we call madness a lot of times are punishments from the gods, but the gods are trying to get you to reform some aspect of your personality or character, but you have to go to the temple and make the amends. And today, people can look back to that, and it's so easy to only see the negative, stigmatizing power of that. Yes, that's absolutely negative, stigmatizing messaging, to say that you're mad because God is punishing you. In some way, I agree that we've made a major advance, because we generally do not frame people's mental health crises as, God is punishing you. But I think because of that, people completely fail to see the value of taking a spiritual or transpersonal dimension to thinking about some of our mental health problems. And just real quickly on the subject of anthropology and voice hearing, there's this wonderful work now by Tanya Luhrmann, who's an anthropologist, and she looks at voice hearing specifically in people who have been diagnosed with schizophrenia or who would meet the criteria for schizophrenia. She's done work in the United States, Ghana, and India. And one of the things that she's shown is that in the United States, when these kinds of experiences are framed as symptoms of a disease in good Hippocratic fashion, people tend to experience their voices as far more hostile, as far more alien, as far more unpleasant. And in the communities that she's studied in places like Ghana and India, people tend to have a cultural framework. Well, these voices are probably deceased ancestors or spirits. And then the tone of the voices, the content of the voices is appropriately different. People tend to experience them as being far more beneficial, as being more guiding. And so I do think that there is a real urgency to be open-minded about these frameworks and say, look, they work. You may have your own personal opinions about spiritual versus materialistic outlooks, but they work for people, and we need to figure out ways of creatively reintroducing these perspectives into the conversation, for sure.
Yeah, this comes up a lot. There is so much that we can learn from traditional religious, indigenous approaches, but it's not about going backwards and just suddenly surrendering our critical thinking and just submerging ourselves into blind devotion and veneration uncritically of those traditions. But it's more thinking about, well, what is it about those traditions that works? Why is it that for some people, being given the message that, yes, this is an angry God, or this is a demon, or this is a jinn, or this is a possession state, why is it that actually is more of a useful way of understanding it than your brain's broken, you got a thought disorder, we're just going to hit you with antipsychotics, and then good luck getting a job that's way, way below your potential because you're tranquilized, and we're going to call that recovery. And so for me, it has to do with these crucial ingredients, and the ingredients have to do exactly with what your book is about, Justin. Seeing that there's some meaning or purpose, there's a reason that this is here. And whether it's about changing my life in terms of changing my job, or thinking about my relationships, or maybe I just need to have more independence in my life, or whatever that early warning sign might be, or whether it's, in a different context about, well, I need to think about my relationship to my ancestors or my relationship to God. And in a contemporary framing, the relationship to God doesn't have to be like, hey, you submit yourself to the authority of the church elder. It can be about, well, what is my destiny on the earth? What is my potential? I mean, I study Jungian psychology, and definitely the teleology, or the purpose of any symptom, is seen within the context of the unfolding of the unique creative contribution that the individual needs to make. Your family may expect you to be a doctor, your sister might be a doctor, your brother might be a doctor, you're in med school, boom, you get hit with anxiety, depression. well, actually, maybe your destiny and your true talents don't lie with the expectations of your family or imitating the context that you're in. Maybe they have to do with rediscovering a side of yourself that's more emotional, more sensitive, more creative than was welcomed in your family. And then you're going to pursue a destiny. And then you have a relationship to your symptoms where the symptoms start to be more cooperative. They start to be more guides. They start to be more signals and messaging from your deeper purpose. I mean, I come from a family of artists. My father's a writer, my mother's an actor, and my brother is a musician and a visual artist, a painter. So I was the black sheep of the family going into healing and being involved with the community. And so I understand my breakdown, my crisis in the system in some ways as helping me to get in touch with and discover what my real flourishing could be, and then developing that relationship with my muse or with my Jung talks about the daimon as the not demon that's possessing you, but the guardian spirit that is, trying to point you in the right direction. And it might be pointing you in the right direction by hitting you over the head with a stick a bunch of times to get your attention. But you can't just try and get rid of the stick because it's a part of you. It's some deeper part of you that's guiding certain potential that maybe you didn't realize. And then, of course, the problem is that when you have spiritually minded people imposing this framework, because I would never impose this on anyone. But what I want to do, and I think this is the genius of the Hearing Voices movement, is to create context where you can explore the possibilities and you can hear different examples of different people who've gone different ways. And you can sort of say, not how do I imitate them or which is right, but to say, well, what's right for me? What is my path? What is my way forward?
Justin, you mentioned mental illness in the past being thought of as potentially caused by an angry God. I wonder if an angry God is a worse metaphor than a chemical imbalance theory.
Mhm.
And the reason I say that is if I'm imagining an angry God, you could externalize that, or you could kind of take a more contemporary Jungian approach, as Will said, talking about a daemon, an aspect of ourselves that guards and protects us and guides us. So there's something more honest about an angry God because it's obviously a metaphor, I would say. Whereas something like a chemical imbalance theory is asserting itself as science. And I see a lot of harm in that if the science doesn't unequivocally support it. Because what it's doing is it's ripping out all of the other potential meanings or significance of a psychosis, of an altered state, and reducing it to this two-dimensional chemical theory. So I guess I'm saying I'm more comfortable with things that are unscientific than psychiatry representing pseudoscience.
Yeah.
Unscientific invites our imagination, and it's not oppressive, and it doesn't authoritatively determine the meaning of an event.
Mhm.
What do you think about that?
Yeah, I mean, I think that's such a good point. These are all, when it comes to the chemical imbalance theory, this is a metaphor. This is a narrative. This is a fictional framework that is sometimes useful for some people. Oh, the chemicals in your brain aren't balanced the right way, and that's why you're having these terrible experiences. And that's exactly the problem. If we just looked at it for what it is, just another metaphor, another framework that may or may not be helpful, may or may not be empowering for some people, I wouldn't have as much of a problem with it. The problem is that this is presented as if it's cutting edge science. And I think that the whole family of chemical imbalance theories, from the dopamine theory of schizophrenia and the serotonin theory of depression, I mean, I think all of them have been pretty uniformly debunked. And we do have to look at them as, okay, these are narratives and metaphors that might help us or might not help us. And now it's just a question of, okay, well, which narratives are most helpful? One of the things that my dad experienced in the 80s was sometimes the voice of God would get very angry. Sometimes God was pretty cool and helpful, and sometimes God was very pissed off and would do and say just awful and atrocious things. I remember once my dad went to the hospital and he said, "Look, give me some of those drugs because I can't deal with this guy anymore." But at least when you have this idea okay, here's an angry God, you can start asking questions. You can start taking a curious and compassionate approach, as in the Hearing Voices movement. Nobody ever asked my dad, what do you think this angry God wants? Why do you think God is so angry? Do you think he's trying to hurt you? Does he want to protect you? Is he looking out for you? What's behind this God's anger? Do you want to ask God why he's so angry? That opens up a whole field for people to start, taking these compassionate, curious approaches. And a little bit I've read on this topic is both of you, I'm sure, know far more about the Hearing Voices Network and these various paradigms and movements. But so much of what I've read is that taking up a curious and compassionate approach can change the content and change the emotional tone of these voices, where as soon as they're seen, as they always were for my dad starting in the 1980s, as the symptom of a disease to be eradicated or at least managed with drugs, that seemed to only make things worse for him. And there was no standpoint, there was no perspective where he could have said, okay, what's the ultimate meaning or purpose or function of these voices? Are these voices looking out for me? Are they trying to put my life on a slightly different path? That option wasn't really available. It's just drugs or no drugs.
That I think is probably the biggest problem with psychiatry, is that it's colonized these questions of what does it mean to be human? What does it mean to suffer? How do I want to make sense of my life? What is my life about? What is the purpose of my life? What am I? All those things are just reduced to is your brain functioning or not? And then, of course, the chemical imbalance approach is very closely tied to the pseudoscience around medications, that, the medications work by correcting these chemical imbalances. And once we're inside of that framework, then you just get locked in. You don't have an alternative. But then the other side of it is to say, well, yes, okay, if you take powerful drugs, if you take tranquilizers or you take Prozac, because Prozac in some ways is chemically similar to how cocaine operates, they're going to have an effect on you. I mean, yeah, there'll be placebo, there'll be expectation, but there's certain effects because they're drugs. That's part of the pseudoscience, is obscuring the fact that these are drugs. So I like what you said, Justin, about, yes, maybe sometimes I do want to just tranquilize myself out of this experience. I mean, that's a very human thing that we all just kind of numb ourselves out sometimes. We want to just switch off or just tranquilize ourselves. But then if it's inside of that authoritarian, you have to take this pill because of this broken brain that you have, suddenly the entire conversation that we usually have about drugs, which is what are the risks? What's the toxic side effect of these drugs? Well, we know with drugs, there's no free lunch. You can't just get high and then stay high. There's going to be some cost, but somehow we've lost that common sense conversation around psychiatric drugs because of this pseudoscience authoritarianism that comes in. So I think that's crucial for starting to have a conversation that actually is more connected with what is possible for people rather than just imposing one perspective.
Absolutely. And sometimes, as I mentioned with my dad, he would say, look, give me some of these drugs that you have because I don't want to listen to this guy anymore. He understood better what he was doing, which was, I need something that's going to buffer these terrible experiences that I'm having and the terrible emotions that I'm having connected with these experiences. And I know some of the drugs that you have will do that for me. And one person I'm a big fan of nowadays is Johanna Moncrief. I really respect and admire her work, and I admire her as a person. I mean, she really gets a lot of attacked frequently by other psychiatrists, and she's just a very cool, very mellow person in the face of that. But I love the basic framework that she talks about, is the distinction between these drug-centered and disease-centered models of drug action. For millennia, we've known that drugs can help manage your emotions, alcohol and opium and hashish, and people have always used drugs for helping to manage their feelings and their thoughts and put themselves in slightly altered states, and sometimes that can be helpful. But then you can also ask, when it comes to alcohol or hash or opium or whatever, you could say, look, I get that you're using this, and I get that this is helping you to navigate some of these really rough feelings. I wonder if it's the kind of thing you should be doing forever. And I'm wondering what kind of risks you might be getting
Exactly.
yourself into by using these kinds of drugs. So let's have a conversation about risks and benefits of the very powerful mind-altering drugs that you're using. And one of the things that she points out, which I think is 100% correct, is that in the 1970s and 1980s, as soon as we moved to this disease-centered framework of drug action, as soon as we moved to the idea that these drugs, the antipsychotics or antidepressants, are somehow reversing a chemical imbalance, that whole conversation got short-circuited. There's a normative sense as, well, you have to take these drugs because they're reversing the underlying disease process. We could no longer have that conversation of, look, I'm happy to give you some of these drugs. I'm happy to give you the sleeping pills because you haven't slept for a couple days. This is clearly taken a toll on your mental health. I'm happy to give you a low dose antipsychotic because you don't want to hear these awful voices and the awful things that they're saying. So let's have a conversation about pros and cons, just as we would if we were going to be, smoking opium or something like that. We would have a conversation about pros or cons. And yeah, I think that we can't, it's hard to have that conversation if you think we're dealing with diseases, chemical imbalances, and so forth.
If it's all right, I'd like to read a couple sentences from your book, Justin, and then we could have a
Sure.
conversation about it. So this is near the end of your book. You write, "It is as if, during the period from 1952 to 1992, a kind of collective amnesia descended upon mainstream American psychiatry, and all of the thinkers who advocated this teleological viewpoint, such as Freud and Goldstein and Sullivan, and even the anti-psychiatrists like Lang, were suddenly, as if it were speaking a different language. They were not saying things that were empirically false. They were saying things that were confused or nonsensical, or saying things in a language we have forgotten how to translate. I can only leave this as a question for historians and sociologists to answer." So we're not historians and sociologists, but I thought it was an intriguing paragraph. Maybe we have some ideas about what happened between
Sure.
1952 to 1992.
Absolutely. Yeah. I mean, in a sense, that was really the goal of the whole book, is to look at the history of madness in terms of a clash between these two paradigms, the dysfunction-centered paradigm, and then madness as strategy, this function, purpose, adaptation paradigm, which is different from the way that historians often do it. They'll often describe the history of psychiatry as a clash between biological and psychological points of view. And I didn't really want to do that. I wanted to describe it in terms of pathology and purpose. You either have the people who see disorder, disease, dysfunction, or you have the people who see function, purpose, and adaptation. Yes, you can also look at psychiatry's history as a clash between biological and psychological points of view. But when you look at it instead in terms of purpose and pathology or function and dysfunction, you just get this very different narrative, this very different cast of characters. And one of the things that I was trying to do as well with the book is to try to understand our current predicament as clearly as possible. As I see it, what happened in the 70s and 80s wasn't so much that there was a biological takeover of psychiatry. It wasn't so much, okay, now the brain people want to have their say. It was really a dysfunction-centered paradigm, which I think took over. And this is important because it's not just limited to this brain-based chemical imbalance. The chemical imbalance theory is one expression of this dysfunction-centered view, but I see the same thing in some strands of cognitive behavioral therapy, which will say, okay, your anxiety, your depression, what's going on is that there's some dysfunctional loop of thoughts and feelings that are creating your symptoms. And so either way, whether you're looking at something like depression as a result of a chemical imbalance, or whether you're taking this more psychological point of view and you're looking at it in terms of some kind of a dysfunctional loop of thoughts and feelings, either way, the core idea is the notion of dysfunction. And it seems to me that that's the idea that we really have to kind of rally our forces against, not so much the bio point of view, because if you think about it, evolutionary psychiatrists take a biological point of view. They take this evolutionary brain-centered point of view, but I don't think that there's anything particularly wrong with a biological point of view. So as I see it, the culprit that I wanted to expose at the end of the book was this dysfunction-centered perspective. One thing that I'm writing a book on now is what exactly happened in the 1970s that made this dysfunction-centered framework so central to our collective language, to the point where so many people have no idea that there are even any alternatives to that. I think that there are probably a plurality of different forces. Just really quickly, I mean, there is, of course, issues where many psychiatrists felt like drugs were helping people to leave the hospital. And they said, okay, psychoanalysis has not been helping my patients leave the hospital, but chlorpromazine did help my patients leave the hospital. So there was that. I think psychiatrists tend to be insecure relative to the rest of medicine. There tends to be this feeling like, well, we're not real doctors, or we're not seen as being real doctors. So I think that this dysfunction-centered, disease-centered, chemical imbalance-centered framing kind of spoke to that insecurity, and that is psychoanalyzing psychiatry. But I think that there's some truth to that. I do think big pharma has some role to play. Chemical imbalance messaging was extraordinarily lucrative for an industry that's always looking for the next blockbuster drug. I mean, I think there's a lot of reasons why the chemical imbalance framing took over. But I think one was that this particular scientist that I'm writing about, named Solomon Snyder, he's the one that came up with this dopamine hypothesis of schizophrenia in the mid 1970s. And he did have some laboratory evidence, some scientific evidence. He really did believe that if you get to the bottom of schizophrenia, what you'll find is dopamine abnormality. So I think that one of the things that happened is that people took theories like Solomon Snyder's, this dopamine theory, and said, aha, finally, we have this rigorous scientific justification for this new dysfunction-centered point of view. And everybody kind of leapt on that and used that as a poster child to advance this new vision. It's a huge question.
So you raise a number of things. I think that the deinstitutionalization question, it's right that psychiatrists were seeing Thorazine and the antipsychotics that were coming in as accompanying people returning to the community. But there's more to that story, because there was also suddenly federal money that started to come in to deinstitutionalize and to get people on Social Security checks so that they actually had the financial possibility of that independence. And there were a number of different factors that go into that story, because I think that does also become kind of a dominant narrative that, okay, the drugs allowed people to get into the community, whereas actually prior to the 60s and 50s, there were a lot of people that went into hospitals, they had a schizophrenia diagnosis or they had a manic depressive illness diagnosis, and then they came out of the hospitals. There was a kind of idea in the early DSM of schizophrenia being a reaction, a schizophrenic reaction to a life circumstance. But I wanted to go into your question of why does the dysfunction paradigm, we could say, become so dominant? And my question is whether it's very useful to political and economic status quos, including the status quo of the family being inviolate, and we don't question child raising or abuse or incest or violence or even subtle emotional abuse that's happening in the family. Because I think in the 60s and 70s, you had this huge questioning. I mean, you've got nuclear war is on everyone's mind. You've got the war in Vietnam is on everyone's mind. You have two president and his brother, president to be, murdered by obviously a corrupt political system. And so I think a lot of people are asking, well, maybe it's the system that's broken. And then there's this huge pushback. So maybe the enforcement of a no, it's not the system, it's you, is part of the Reagan corporate counter-revolution against the 60s and 70s protest movements. I mean, that's just a question that I have, because I know that the dominant narrative of it's a biological problem in the sense of a broken brain came not just with pharmaceutical industry, but it was this alliance between the pharmaceutical industry, government policy, the profession of psychiatry that was really under attack, and also the families that felt under attack.
Mhm.
Because if you start to question, well, maybe society is driving people crazy, the status quo and the family, the corporations, and the government starts to become threatened. So that would be, I think, an interesting way of answering the question of why did this become so dominant.
I think the time period is interesting that you selected in the book, 1952 to 1992. If we think just a little before 1952, it's a very dark chapter for folks with so-called severe mental illness.
Mhm.
We have first, this is a bit grim, we have the Nazi Holocaust.
Mhm.
The folks who were the first to be targeted and exterminated were people with developmental delays,
Mhm.
mental defects, severe mental illness. And in fact, the gas chambers were designed to be used by psychiatrists for them to kill their patients. Shortly after that, I believe in the 40s is when the man who invented lobotomies got a Nobel Prize.
Mhm.
And then shortly after that is when we have the development of antipsychotics, as you said, chlorpromazine, which was discovered when they were searching for new anesthetics. And the first name for it was actually a vegetative stabilizer. They realized they could give it to people to sedate them, basically outside of an anesthetic context, and mellow them out, reduce behavioral problems, and so on. So I guess I don't have an answer to your question. I just think that period is really interesting because it seems like the answer is going to have to account for the really significant period that happened just 1 or 2 decades prior to that.
Yeah, absolutely. And I mean, it's so fascinating with the chlorpromazine, and these generally were not thought of as antipsychotic drugs as having some specific power to reverse the disease process underlying schizophrenia. They were often described as major tranquilizers. And so there was more of a sense that these are pills that can help some people manage their emotions and their thoughts until they can really get to the core of the problems that they're facing. But yeah, one of the things that I think we do have to constantly challenge is these mainstream narratives. The mainstream narrative of the 60s was, you had a bunch of terrible psychiatrists who would blame everything on the mother, the schizophrenic genic mother, or the refrigerator mother, or the traumatizing family. And these poor parents were so stigmatized. And then, thank goodness, this heroic, disease-centered model came along and liberated patients and their families from all of the terrible shame and stigma that they were working under. And of course, there is some truth to that. There were some pretty stigmatizing and shame-centered narratives out there, but to suggest that that was the only narrative, and thank goodness that this disease-centered model came along and liberated all of these patients and their families from shame and stigma. I mean, that it's such an incredible caricature of
Yeah.
the plurality of different visions and voices.
Yeah. It's also a misrepresentation of Lang's view
Mhm.
because Lang saw that, yes, okay, maybe the parents are creating a very disturbed context for their kid that can generate these terrible binds that lead to the strategy of psychosis and the strategy of madness. But Lang really emphasized that the parents themselves
Mhm.
had been socialized into a larger context. And that's why he kind of zoomed out from the family into society itself as being disturbed and normalcy itself as being a problem that needs to be addressed.
Yeah, I mean, one thing I do like about Lang specifically was that he said, okay, yes, of course, there are family dynamics that can help us understand what's going on in these mental health crises and what we call psychosis. But yes, I think he always looked at family dynamics as a microcosm of greater social forces. And he was always trying to understand how family dynamics are themselves byproducts of these greater social forces. So my sense in his work, the point was never, we're going to blame mommy and daddy for all of your problems. The point is that we
Mhm.
need to look at how these social forces impact you directly and via this particular institution called the family. But it seems like today, even mentioning the link between, say, childhood abuse and neglect on the one hand and adult mental health crises on the other, it almost seems like taboo to talk about. And I think that's why some people who have written extensively on the link between abuse or neglect and later mental health crises, I think, they tend to be attacked, like John Reed, for example,
Yeah.
who's written a lot on this topic and tends to be attacked, pilloried, ridiculed. Oh, you're just trying to bring us back to the bad old days when we blame everything on, mom and
Yeah,
dad.
well, I think it speaks to a problem in the culture, which is that we tend to be focused on find the bad guy and get rid of the
Hmm.
bad guy. And there's a kind of a moral puritanism that's endemic to American culture, which maybe feeds into the idea of chemical imbalances because we've sort of figured out what the problem is. We can identify it as something that's external and that we can eradicate it. It's almost like the war on mental illness, the war on schizophrenia, and that misses the complexity. And we
Hmm.
don't, so much of the mental health system, I think, and the role of psychiatry is to kind of manage guilt. It's like how to take guilt off of the individual. That's very appealing. If you're not able to be so-called productive in society, it's very appealing, a narrative that says, well, it's not me, it's my chemical imbalance. Well, my belief is that why can't we be compassionate and forgiving without having to just transfer guilt onto the chemical imbalance? I mean, there's a way in which we sort of use psychiatrists as a way of saying, okay, you have this family problem, you have this problem with this individual. Now you're doing the right thing because you're under the care of the authority figure. And well, I think it's a much too simplistic a way of understanding the complexity of it, that there's individuals and they may have some pathway that involves challenging their parents, or they may have some pathway that involves taking personal responsibility. But that doesn't mean that everything has to land on it's all up to you to pull yourself up by your bootstraps, or it's all going to be about
Hmm.
blaming the parents. And I think that there's an atmosphere of fear and scapegoating around
Sure.
madness and around mental health that's driving a lot of this. I mean, the mental health system is really a way of society managing its fear of madness and normalizing a certain response to it so that we don't have to think about this thing that we're afraid of. And there's parallels with what we do with our elders and what we do with death, that we
Hmm.
put them out of the frame entirely because we just want to be on this productive track rather than going into these realms that are going to be scary and confusing. And then maybe they challenge us to answer these kind of deep existential questions that no outside authority can answer for us. But, instead we just push them all away and it becomes more fodder for the taboo.
Well, Justin, I really appreciated reading your book, and I found it validating to read the ideas of these thinkers going back centuries, even seeing function in so-called mental illness and redeeming that from contemporary psychiatry where it's been buried. However, I also had a feeling of grief reading
Hmm.
your book too, because all of the thinkers, well, perhaps they had private experiences that we don't know of, but I would say they were all writing outside of their own experience. These were all folks reflecting on clinical patients.
Hmm.
And my wish for the future is that we get to write our own stories. We get to have our own theories and write them and get published and be considered important thinkers that scholars care about, and that our stories are more diverse. They're not just the reflections of, social authorities, so to speak.
Hmm. Yeah, absolutely. Absolutely. I think it's worth feeling grief and worth feeling upset about and struck by the fact that these are almost always, with some exceptions, like Burton, who himself struggled with melancholy and said he used writing as a way of kind of struggling with his own mental health issues. But it was almost always physicians speculating about the nature of the problems that their patients were having. It was the physicians and the patients, and there was very little idea that the patients, these mad voices, would have any legitimacy, any say, any special insight into their own issues and into their own crises. So, in my view, I think that's the most exciting path forward right now, is just getting away from the people who claim to be professionals, getting away from the people who claim to have this kind of distanced, authoritative take on understanding madness or mental health crises. I think the future is in peer support, in therapeutic communities that are led by service users, patients, ex-patients, psychiatric survivors. I mean, I think that that's exactly where the future is. I hope that's exactly where the future is going, for sure.
Me too.
Yeah, hear, hear.
I also wanted to ask you about what you're working on now. I believe you're writing a new book. Is that the case?
Yeah, absolutely. I'm writing now a trade book. So the book that I wrote was an academic book, largely for colleagues. I'm really excited to be writing a book that brings some of these ideas to a more general audience. How did we get biomedical framings come to dominate the conversation in the 1970s and 1980s? And it looks specifically at the life and times of one particular neuroscientist and psychiatrist, Solomon Snyder, and some of the other psychiatrists in the 1960s. They thought they were helping people reframing some of these mental health crises in terms of biological problems of the brain. And I think that their vision was really kind of appropriated by psychiatry and by some of the pharmaceutical companies in ways that were not helpful at all. He wanted a drug that would mimic certain aspects of psychosis or schizophrenia. And once you had a drug like that, then you could figure out exactly what was going on in the person's brain, and then you would get at the biological roots of madness. And so part of the book is just looking at this very weird chapter of American psychiatry that a lot of people don't know about, where psychiatrists were frantically trying to put patients on drugs like LSD and speed in order to create a kind of temporary schizophrenia so they could figure out what was happening in the brain. That's the short version of the book.
So just wrapping things up, if you don't mind, Justin, letting listeners know how they can contact you if they have questions about your work or want to know how they can read more of your publications, that kind of thing.
Yeah, absolutely. I have a website. It's justingarson.com. So it's easy to remember. And that has some of the things that I've written, and it has a link where you can reach out to me, and there's different things about my work and how I got interested in this topic. So you could go there and dig through some of the other stuff that I've been working on.
And remind us the name of your book.
The book that I wrote 2 years ago is called Madness, A Philosophical Exploration. And then the one that I'm working on now is called The Madness Pill, The Quest to Create Insanity in One Doctor's Discovery That Transformed Psychiatry. That one won't be out for a little while.
Justin Garson, thank you so much for joining us on Madness Radio.
Thank you. It was really, really a pleasure to talk to you both. I'm really grateful to be invited.
And Jessica, thank you for co-hosting and being show producer for this episode. We really appreciate it.
It's my pleasure. You've been listening to an interview with Justin Garson. Justin is a professor of philosophy at Hunter College. He studies changing paradigms of madness. He's the author of the academic book, Madness, A Philosophical Exploration by Oxford University Press. And he occasionally writes for Eon, Psychology Today, and Mad in America.
And that's all the time we have on Madness Radio. Thanks for tuning in. What does it mean to be called crazy in a crazy world? Listen to Madness Radio, voices and visions from outside mental health.